Hi, my name is Brent Crawley.
And I'm Jim Plemons.
And we are the Turning 65 Advisor. And we want to thank you for attending our Medicare 101 presentation. During this presentation, we're going to be going over a few things that we find to be most important for most of our customers and making sure that you understand the options that are available for you and the changes that are happening with the Medicare plans. Now, here's the good news. We understand that each and every one of you is special in your own way. We're special because we know that. I know that sounds really cheesy, but let me explain for just a second. You see, every single one of you is going to have your own budget that you need to abide by on a monthly basis. You're all going to have your own physicians or lack thereof, prescriptions or lack thereof. You got your wants, your needs, and desires when it comes to how you want your insurance plan to take care of you. And because Jim and I are an independent agency and we're advisors that work with multiple different plans, we can easily put a plan together that's going to fit your needs.
Just like a crazy pair of socks, we want to find a pair of socks and a medical plan that fits you. You deserve a plan with benefits that fit your needs and your budget.
So let's talk about why you might want to work with us. So the Turning 65 Advisor, we've been in the business for nearly 15 years. We're also licensed insurance advisors through the Arizona Department of Insurance, and we have lots of other designations and certifications that we have to continue to uphold every year. You see, just because you are licensed through the Arizona Department of Insurance does not mean you're actually allowed to sell Medicare and Medicare-related products. We have to go through a rigorous process of being certified through compliance with every single insurance company that we represent and going through their training and re-education every single year. We spend about 80 hours of re-education and continuing education every single year just so that we can continue to do business and be able to serve you and help you folks here. We're here all year round. We're not here just during the enrollment period. And frankly, it's sad to say that there actually are a lot of agents that are full-time in business during the enrollment period and then they kind of disappear for the rest of the year. It's actually very sad. Would you like to do business with a doctor who only was in the business part-time or an attorney who has only been in the business part-time? We're here full-time, 5 days a week, 50 weeks a year, folks.
Right, and on top of all that certification that we have to do with each specific carrier, we also have to pass an annual AHIP exam that stands for America's Health Insurance Plans. And it's a national exam that covers Medicare, the basics of Medicare, as well as fraud, waste, and abuse. We're also trained to use the Medicare.gov website to help you compare your prescription drugs and to find the best plan that fits you at the lowest cost.
So as we go through this process, our promise to you is that we're going to give you an unbiased opinion. I like to tell my clients that I frankly don't care what insurance plan you sign up for as long as it's the plan that's the right fit for you. And this is a process. This is a relationship between us and you in the event that you decide you want to work with us. We want to partner with you. We want to team with you. We want to be friends with you. We want to make sure that we're giving you the plan that's overall going to be the right fit for you and your loved ones. We want to teach you the differences between the types of plans that are available, and we want to make sure that your physicians and your doctors, or lack thereof, we want to make sure you're getting the things that you want and need out of your insurance plan.
And our promise to you is that we're going to verify that you're placed within a network that allows you to use the hospital and the doctor of your choice. We're going to assist you in applying for extra help or low-income subsidy if you qualify. We're also going to offer an annual benefit review to ensure you're always on the most affordable plan that fits your needs. Our role is to help you navigate through Medicare at no cost to you. When are you eligible for Medicare? Well, basically you're eligible for Medicare when you're 65 years old and you qualify, or if you qualify due to a disability or other special situation. You also need to be a United States citizen or a legal resident and you've lived in the United States for at least 5 years. Even if you're already getting Social Security, you have to wait until you're 65 to qualify for Medicare. You have to be 65 and your spouse's age doesn't count. So let me elaborate on that a little bit. If your spouse happens to be 63 and you're turning 65, only you at 65 are eligible for Medicare. Your spouse still has to wait a couple years. So even if you're not collecting Social Security, you're eligible when you turn 65.
Now, a couple of things I want to make sure we touch on really quickly. So, Jim, are people automatically enrolled into Medicare when they turn 65?
They're automatically enrolled into Part A. You qualify for Part A through working for 10 years or 40 quarters.
Okay.
But
Go ahead.
Part B, you have to enroll in separately.
Okay, perfect. So there's going to be a lot of options when it comes to Medicare. We've kind of talked about eligibility. We've discussed that. But let's make sure that you understand the different types of plans that are available. Again, we believe in making sure that our clients are educated. Education is key. That way we don't have to sell you anything, you know what you're choosing. Okay, so we'll talk about option number 1, which is Original Medicare. Some of you might be on Original Medicare, and that's okay. It's just important that you understand some of the areas of exposure that you may have. With Original Medicare, it operates off of a sliding scale of 80-20. What does that mean? Basically, the key word here is coinsurance. Coinsurance means you have an insurance company or an entity paying a percentage of the bill, and you have to pay the other percentage. A coinsurance is always a percentage. It's never a fixed amount. So 20%, 15%, 10%, whatever it might be, that is called a coinsurance. You are responsible for that 20% when you receive services from a medical professional and you're on Medicare Part B like Boy. So B of Medicare, that's your outpatient stuff. That's when you're going to the doctor and you're going back home, or the emergency room and you're going back home. Think of it like this. If you're spending the night, it's probably Medicare Part A. If you're not spending the night, it's probably Medicare Part B. As long as you're in and you're out in the same calendar day, it's likely under Medicare Part B, and you're going to be paying 20% after a small deductible that you have for Medicare Part B each and every year. Now, the bad news is this. While people are typically used to systems like that, a lot of people have programs like that through maybe their employer coverage. You've probably seen things like this before. The problem here is that there's no cap on your out-of-pocket expenses or your exposure, as I like to say. So let's use this as an example. Say you go into kidney failure and you need dialysis treatment. Well, the Centers for Medicare and Medicaid Services, CMS, or the parent company, managing company of Medicare, right, organization rather, they have determined that in the state of Arizona, dialysis treatment typically costs around $900 a pop. And if you go on to kidney failure, you're typically getting dialysis treatment 3 times a week. So for those of you who are good at math or have a calendar nearby, 3 times a week of dialysis treatment times $900 per treatment times 52 weeks a year. Now that's a lot of money, but to just make the math easy for you, if you're paying 20%, that comes out to $28,000 a year. Now $28,000 a year is just your cost for your dialysis treatment alone. That's not for your other doctor's visits, etc. And with Original Medicare, that is the way it goes, folks. You will be out of pocket those massive expenses in the event that something catastrophic happens with your health. So what can we do about that? Is there another plan that's going to be around there that's going to help pick up some of those 20% and those big deductibles? Is there a plan that, well, I like to say, that's going to come in and save our butt? Yeah, there is. That's called a Medicare supplement or a Medigap insurance plan. Okay, so these types of plans are a secondary insurance policy that you purchase through a private insurance company. In the state of Arizona, they're standardized. So here's really what that means. The plans are going to be the same no matter what insurance company you purchase them from, as long as they're identified by the same letter. Let me make that even more simple. Let's say you're shopping for a Medicare supplement and you're looking at 2 insurance companies, and both of them offer a plan N, a plan G, and a plan F. Okay, so you've got 3 different plans from 3 different companies, or from 2 different companies. Every single company is going to offer you the same benefits in the state of Arizona for the plan Fs. And every plan is going to offer you the same benefits in the state of Arizona for the plan Gs. The point is this. The benefits are not going to change from one company to the next as long as you're looking at the same plan, but the price might change. So that's something you might want to take into consideration when looking for a Medicare supplement plan. The benefits don't change, but the price does. And this Medicare supplement is going to come alongside your original Medicare. It doesn't take over for Medicare. It works in conjunction with Medicare. And it's going to pick up the portions of the bills that are left behind by Medicare, so you don't have to. The problem is these plans are going to come at a price. They're wonderful plans. We love them. We actually offer a lot of them to a lot of our clients. A lot of our clients have these plans. However, again, like I said, they do come at a price. And we've seen them as high as $300 a month sometimes if you're doing business with a company that doesn't have stable rates. So we will make sure that we have gone through all of the companies that are around to make sure that you qualify for a Medicare supplement and that you're getting the price that you deserve. Now, in the event that you feel like maybe you can't afford that premium, because after all, you still have to pay your premium for Medicare Part B, and you have to pay your premium for your supplement plan, and Medicare in its original form doesn't cover prescription drugs. So you're going to actually have to purchase a prescription drug plan as well. So now you've got 3 plans that you're paying for on a monthly basis, and it can get exhausting financially, okay? It might just be out of reach for some people. So let's talk about option number 2 really quickly. That's a Medicare Advantage plan. A Medicare Advantage plan is when you allow a private insurance company to actually manage your Medicare benefits instead. We like to call them managed healthcare plans for that reason. So this is when you allow a company like, for example, maybe Bright Health or Aetna or Cigna or United Healthcare, whatever it might be, you allow a company like that to actually come in and manage your Medicare benefits, and then you're playing ball with their plan. Sometimes there might be a small additional premium, but it's typically not much. Actually, a lot of those plans are $0 on a monthly basis. We'll make sure that we can find a plan that's a right fit for you, but you still have to pay your Medicare Part B premium. However, all of your medical care has now been placed in the hands of that private insurance company. And those companies are typically going to put caps in place so that your out-of-pocket costs are limited to a certain point. So let's just say you have a plan that has a cap of $4,000 and you end up having that kidney failure situation and you go on to dialysis treatment, right? If your costs are adding up, once your out-of-pocket costs have hit, let's say $4,000, just for an example, you're not going to have any costs for the rest of the year. The insurance company is going to cover everything. So they're actually giving you that cap on your out-of-pocket expenses. So there's a few different plans to choose from. It's just important that we figure out which direction is the right one for you.
There's so many plans and types to choose from, it can be very confusing. We have Medicare supplements, we've talked about Advantage, prescription drug plans, special needs and chronic needs plans, health maintenance, HMO, preferred provider, PPO. It's a lot to understand. It's very confusing. This is why we're here. We can show you which plan fits your needs.
It's important that we put a little extra emphasis on Medicare Part D, D like drugs. So as we go through this process, it's important to understand that there are many different ways for you to have your prescription drug coverage covered. Whether it's through your employer plan that you have, whether it's through the VA benefits that you have, or whether it's a standalone prescription drug plan that you have in combination with your supplement and your original Medicare, or we can actually help you find a Medicare Advantage plan that has your prescription drug benefits built in. All of those are great options. It's important to figure out the one that's right for you. However, don't delay, because if you delay, you could be subjected to Medicare Part D penalty through Social Security if you don't pick a drug plan in time. There's also formularies that we need to look at, which that's the list of prescription drugs that each drug plan covers. We want to make sure your prescriptions are on that formulary. We want to make sure that you understand what's called the coverage gap or the donut hole. This is your limit that you have on your prescription drug allowance every year set by Social Security. These are all important things to understand. We go over all of those with you at our consultations that we have every year.
So what now? Right now we're going to open up the chat box. We're available on the chat to answer any questions you might have up to this point. So feel free to type in your chat, type in the question, we'll get an answer to you as quick as possible. Also, we've got a couple forms that we'd like you to fill out. The first one is an information request form or a permission to contact. That's going to allow us and give us the permission to reach out to you and contact you, because there are rules with Medicare and we can't just call you without your permission. So please get that back to us as soon as possible. And also the scope of appointment form that's up there. That's going to break down and explain a little bit more about the types of things we're going to discuss when we meet. That form you can bring to the meeting that we have, but the information request form, we'd like to get that back as quick as possible, because there's one other reason we need that. Because you stayed to the end today and you visited with us and listened to all our Medicare information, we want to send you a $15 credit for Grubhub. So you can get a meal to share with your family or a snack or whatever you can get for $15. We know it's not a lot, but it's our thank you to you for coming to our meeting today and listening to us.
So thank you folks so much for coming to our meeting here today. And again, the chat box is available. You also have our contact information. Please visit our website. You can drop us an email, give us a phone call, however it is that you want to contact us directly if that's something that you have, if you have more private questions that you want to ask. We're available for you. We appreciate all of you folks. Thank you so much for attending. Have a wonderful day.